Well, Dan and Jackie, it seems to be a blame game of both parties involved, where each feels the other is the reason of the LSU School of Medicine financial crisis. Now, back before hospital privatization even began, University Health says LSU has taken more than $200 million in reserves, attempting to balance its budget. Since privatization, University Health says they have paid LSU more than $380 million, in addition to the annual state budget allocation the medical school is receiving. University Health says invoice errors have been submitted to them each month over the last 3 years, requiring University Health to routinely adjust and correct the errors. At this point, University Health representatives say they want a solution to this problem, especially since the School of Medicine told them if they pay $50 million a year for professional services, they would then be able to balance their books.
Well, if you went on 60 days later, they came to us and said, well, we made a mistake. We need you to pay us $100 million. So we're now paying them $100 million a year in professional services. This is over and above what the state pays them just as a school itself. And so even though we doubled the amount that they initially said was going to balance their books, the draw on cash reserves has continued.
Now, from these issues between the two parties, legislators Commissioner Jay Darden and Governor Edwards are stepping in to try to mend ties and fix this financial issue, especially since these two entities are on the same campus. And legislators did meet today, but no word yet on what happened from that meeting. And of course, Dan and Jackie, we did reach out to LSU School of Medicine numerous times, but they have not returned any of our requests.